Ever wonder what makes the greats great? What makes the successful successful? What makes the brilliant brilliant? Our Tuesday meetups with the celebrities of pharma industry and science are your one-stop shop to all these answers and more. Join us for Pies of Life, an initiative of the Biopatrika Industry Mentorship Program, where we bring your dream mentors to you.
I think all of you will have to say something. Yes. Okay. Yeah. So Rohini, over to you.
Thank you, Naren. Thank you for the opportunity. It is a pleasure to be with all of you today. I'm definitely, delighted to share with you my career journey, as I've been, I guess, lucky, I would say, in some ways. The stars are lined up for me to pursue science. My love for science started very early, and was quite, I would say, influenced by the family members and some of my relatives who were, doctors and scientists. So I grew up in Hyderabad, actually, in India. And with my siblings, my older brother is a surgeon, and my brother and I, we were the two who pursued science, and then rest of the two siblings pursued, computer sciences. And our family was very focused on human relationships, I should say, as I would classify it, because we are a very extended family, and everybody valued a lot of our engagements across the extended family members. Always, my home was filled where I grew up with, festivities, relatives. So with that, I feel like in my career, it taught me resilience in many ways, because never would I come back from school and find, the same old routine at home. Every day it was a different uncle or an auntie visiting. Every day my mom needed help or something that I needed to, step in and step up and do what it took. So in some ways, a very loving, supportive family is what I was blessed with. And, right up in my early part of my education was, really the core. Our family focused a lot on education. And so we all, knew that was the path to success in some ways. And, a lot of hardworking people I was surrounded with. So it was in some ways a norm to be part of a culture that focused on pushing boundaries, made sure that you were helping and serving. Servitude was part of it as well, and so there was always the opportunity to serve and opportunity to help. And so that early part of my upbringing, in the culture, I think really shaped me as a person and who I am. And so that part, I feel, whether it's in our education or it's about building opportunities through experiences at work, really was not that different. As I always say this to my colleagues at Amgen, that I treat Amgen like I treat, how I would spend my own money. And whether I'm going on a business trip or I'm on a personal trip, I don't think I would treat Amgen money any differently. So those, core values that the company has, I feel I could relate to very well, because those core values were sort of, inculcated through our culture growing up back in India. And so I started off as a scientist. I did my PhD in the United States in SUNY, and then I did 2 postdoctoral fellowships. And I studied molecular biology. Back then, yeast-2 hybrid systems and trying to functionate proteins was, a novel sort of opportunity. So I had a chance to work during my postdoctoral fellowship, apply my molecular biology skills to functionating some of the unknown proteins through yeast-2 hybrid system. Then I went to UCLA and did a second postdoctoral fellowship where I was exposed to monoclonal antibodies. And we were working on structure-function relationships. At that time, it was not known what structure of the monoclonal antibody was really imparting some of the effector function or even some of the stability, functions or even half-life of monoclonal antibodies. So that postdoc actually then gave me an opportunity to join Amgen. And once again, I always think of my career as a path that flew, in a very smooth way. I was given these opportunities and I happened to be at the right place, right time in some ways. So once I finished my UCLA postdoctoral fellowship and I joined Amgen in 1997 was not a company that had monoclonal antibodies as therapeutics. So again, my good fortune that I entered the company at a time when I had just completed a postdoc. I had the molecular biology experience. I knew what monoclonal antibodies were. I had done my immunology as part of my PhD. And then I had all these techniques at my disposal where I could take the molecular biology and apply that to then come into Amgen and do protein engineering. So my first project was really improving the half-life of FC molecules. And FC fusions were part of Amgen's pipeline at that time. So I got into that, and very quickly, our company started asking the questions, hey, should we do monoclonals? Because the success of Herceptin was very evident. And looking at that success, Amgen was going through what we would now classify as a term. We use this terminology called transformation very commonly now. But back then, in 97, the company was actually going through transformation, but it didn't use that terminology, okay? So at that time, it was more about moving from growth factors and cytokines into, these monoclonal antibodies. And there was a lot of questions at hand. Can we make enough? What is the best isotype for one to make? How do you make a monoclonal antibody as a therapeutic when the human physiologically, makes a lot of monoclonals? Will we be able to make a monoclonal that will not have anti-drug antibodies? And then those anti-drug antibodies make a safety concern, right? For the patient, become a safety concern. So these were all, very early questions that we needed to address. So I spent early part of my career after joining Amgen for about 5 to 10 years, really establishing the expression platform of monoclonal antibodies. And the way we produce those monoclonal antibodies, because as a company, Amgen was used to making Epogen. One roller bottle, when produced of Epogen, can treat a patient for 1 year. Okay, so the amount of Epogen that is needed to treat a patient is very, very, very low. It's a highly potent molecule, as you all know. Now, compared to that, when you're thinking about the molar molecular weight of a antibody, the molar masses that are needed to treat a patient, this was a huge concern for the company to figure out what is the best way to do this, when we were just starting that monoclonal antibody era. So I spent a lot of time, actually, early part of the career to optimize the expression system, build some high throughput systems for expression of monoclonal antibodies. And then, I joined the company as an individual contributor, but slowly my group grew. and we became the main protein expression group for Amgen. And after that, I got a chance, to lead what was not just cell culture and expression, but I got a chance to lead then upstream, downstream, and analytical. So as the company was growing in its interest and its investment in monoclonal antibodies, very quickly, we were starting to recognize that when we select a molecule, just like selecting a target is one of the most critical steps, I would say, for any organized biotech, right, biopharma company, because, targets like KRAS, were undruggable for 40 years. And how we have been able to advance a small molecule to KRAS recently called Lumakras. So similarly, started to recognize that, identifying a protein sequence for a therapeutic is just as crucial for manufacturability. So it's not just about target identification, but it's also about the modality choice. So the choice of modality, the primary sequence that you select for the protein can be just as, I would say, impacting or from a business standpoint or influential in making a drug. So early on, we started to recognize that the molecules that we would select from research didn't always behave as a great therapeutic when we advanced it through commercialization. So what that means is, if you had a target product profile and the patient needs at-home administration of a drug, but you select a protein sequence that goes through many chemical modifications, you're not going to get the stability that is needed for at-home administration. So we started with that end in mind, and we started asking simple questions during our selection process. And then, as Naren pointed out, we called that process eventually a molecule selection process or manufacturability assessment. Now, many companies call it developability. They call it manufacturability. Others call it, I think I heard the term druggability. So there's many terms that companies now use. But that early on in 2000, I think this all we did this work in 2005, 2006. And that was one of my first talks when I gave at Cell Culture Engineering about manufacturability assessment and the power of it, because it's not just about knowing what attributes you want in a molecule to hit the target product profile, but it's also knowing what not to have in a molecule. And so we said, okay, if this is the case, what we need to do is, for success, start selecting those molecules, use that checklist to select those molecules, not just make a note after selection that, oh, we've got a good molecule or we don't have a good molecule. What we need to do is to make sure that process development works with research upfront, looks at multiple molecules before selecting the right molecule. So we decided to invest our resources upfront at that interface and use our knowledge in process development, using the right assays, measuring, making sure the right attributes that matter are measured. We knew the criticality of those attributes, and we really conceptualized this whole manufacturability assessment as a business process. And we started seeing the benefits. We have a drug that's on market right now called Aimovig. It's for migraine. That I remember when we were selecting that particular molecule, we had 4 molecules we were advancing. The molecule that we had actually selected, the first one, ended up with full vasculitis, in cynos. And the lead molecule, we don't know why. We had no idea why that molecule had such a negative safety profile. So we very quickly were able to switch to the backup molecule without losing any time. And that in that case, we had selected 4 molecules we were prosecuting at that time. And we were, again, we ran into this backup molecule that had the ideal properties. We didn't get slowed down as a company. So it became a real advantage for Amgen and became a differentiating feature for us as a company to be able to work with research, invest our own resources, invest in platforms for those modalities such that we can select the right sequence and commercialize it very quickly. So it became an advantage for agility, became an advantage for speed. Another thing that I think differentiated us was the fact that our pipeline, I don't think it's unique to Amgen, but our pipeline is constantly evolving into a multimodality pipeline. So what's happened is this molecule assessment process that we established for monoclonal antibodies applies for bispecifics, it applies for multispecifics, applies for small molecules, applies for siRNA, and we're working on cell therapy, and we can do the same thing with it. So it ended up becoming a platform that we could use across our portfolio. And so that is one of the, I would say, highlights, as Naren was pointing out, in my career, that really gave me the opportunity, the experience, the ability to work across our partner groups and really bring forward a business impact. The second area that I've spent as part of my career, and I would advise all of you to do this if you get a chance, was establishing a group called Attribute Sciences. So my experience, as I told you, and my core competencies in molecular biology and cell biology. But one of the leaders at Amgen recognized me and said, hey, we need your leadership to build an end-to-end attribute sciences group. So attribute sciences is really an analytical organization, okay? In any traditional company, it would be called analytical sciences. I chose to name it attribute sciences because I really wanted to make a statement that, it's not about the methods, it's really about the attributes that we measure, that we need to focus, and the tools and the methods, are secondary to the attributes. So that was a great experience. And when I was given that opportunity, first thing, I was really scared. I was not sure I'm up for it. And it, analytical takes a lot of interpretation, translation, and you need a lot of orthogonality, because you have to look at, that attribute, not just using one way of measuring, but you have to confirm those data using other orthogonal methods. So my way of thinking in upstream, I was not sure, would have provided me the, skill sets to lead that organization. But I, had a lot of support, great team, and again, great leaders trusting me with my leadership to lead that. So that, anytime somebody asks you to get out of your comfort zone and, step into something because they trust you, do it, okay? Because I would say sometimes, the confidence that others show in you gives you the confidence to then lead and move forward. And it's hard to gain that confidence by yourself. So trust, the people around you who are your sort of sponsors and advocates, and go for it. The other part in my career journey, I would say, I have spent a lot of time thinking about and influencing is through my core competency in gene expression, yield improvement projects. Yield improvement has been in drug substance. So I'm currently leading the drug substance technologies group. It's a global group with 7 different sites. And I also lead our Amgen Massachusetts site in Amgen. And in my current role, it's an end-to-end group. I spend a lot of time with my team in yield improvement projects. We've been able to have, NPV business impact of about 500 million or so. So very, very large impact from yield improvements, because our ability to build newer facilities, we call them manufacturing of the future facilities. We built one in Singapore, we're building one in Rhode Island. We are bringing forward new technologies such as perfusion technology, single-use technology, looking at vector optimization, cell culture, media improvements, and all of those things together. Technically, we've been able to improve the yields by what I would say, since my career at Amgen is very long now, 23 years, I have seen an improvement of about 30-fold in just protein expression. So, it's just pretty significant. And that really translates to a very substantial, a very tangible business impact in the context of what Amgen wants to achieve. So that's an area that I have really spent a lot of my time working on. And then last but not least, I think, getting the right team in place is really, really critical. And I can't say enough about, the team members we get to work with are just phenomenal. And I think, focusing on bringing in members who will add and enhance what we already have within the team has always been an area of my focus. I was able to hire a couple of folks right at the beginning. This was in 2011 when Amgen was going through the transition from fed batch into perfusion technologies. I was able to, bring in external members and candidates into Amgen with that expertise, so they can complement us. We weren't sure we will make that turn into perfusion, but Amgen did make that turn, and the team member I was able to hire, gave us a jump start. I mean, it was just fantastic. I mean, that person's career has also progressed extremely well, but more importantly, bringing in those skill sets, bringing in that member and bringing in that diversity of thought to add to the existing team has been instrumental in being able to move us forward, not only as a company, as a group, but also as a team, because we, couldn't have done that without those complementing skill sets. So those are some areas that I have focused in my career. I feel that, as Amgen has been growing as a company, we are a 40-year-old company now. And we've had 4 decades, you can think of. Our, journey continues, at least my 23 years at Amgen. I feel I go to work energized every day simply because of the people I get to work with. I'm sure the mission is very important. I, get to serve patients, and the impact from the work is very gratifying. But I think more, that probably is going to be true whether I work at Amgen or I work at Genentech or I work at Novartis, right? But it's the people, team members that I get to work with that, really make me get up in the morning and, become part of that excellence. And there is not a problem that, I have faced at Amgen yet that our team can't solve. And so every time we get up, and we bring a team together and we tell them, go improve the yield by 2x, go reduce the time twofold, and there's so many examples that I am amazed. I will tell you, even with COVID, okay, there's so many examples that I have had the, great fortune and the privilege to be part of, where, my career, I used to be in their shoes at one point, and I was not the person who was making, setting those expectations. but I was part of that journey and I got to learn and contribute and participate. But now, as a leader, I can walk into a room of great, team members and set those expectations and goals to say, hey, we've got to go twice as fast. And I am yet to come across a problem that the team has not actually solved. So it is such a, amazing experience if I think about it. And part of why I got into science, as I reflect now, now that I've been able to do so after having a long career like mine, I really feel like, science has a lot of unanswered questions. And when you answer a question, and if you get that answer right, it could really change lives. It could save lives. The impact is so tangible. So the fact that, as a kid, I've always been very curious, inquisitive, and I always wanted to answer questions. I had a lot of questions. And so the opportunity to answer questions, I think, being part of this scientific community, I feel is really I feel I'm very blessed in some ways when we ask the right question and we're able to go off and run those experiments and come back with that answer, and how gratifying that is, when that answer ends up being a very high impact one. So maybe I stop here. I just wanted to share some of my sort of personal traits and who I am as an individual, but more importantly, sort of my career journey and how I started very early on as a scientist, and then, where I am today with you. And I'm happy to answer any questions or any aspects that maybe are more interesting to you that I may not have actually covered, and if those are of interest as well. Okay.
Yeah, please go ahead. Just raise your hand and moderate. Yeah, Akshay, go ahead.
So you mentioned earlier that you had a large family and to deal with a lot of your siblings and uncles and aunties. Are there a lot of skills that you had taken in that situation when it comes to managing teams and people and looking for particular attributes from them to develop your team?
Yeah, it's a good question, Akshay. I've been thinking about that, as I work with the teams. A lot of what I think I like to see in a team is collaboration and partnership. And what am I doing to make the other person better? So how am I improving R&D's goals? How am I improving the goals of manufacturing? How am I improving the goals of quality when I was leading attribute sciences? So if you think about it, the traits we have as relatives or extended family, a lot of what we are doing, at home or even in settings where we are vested in each other, we're really trying to understand what is that person really trying to achieve and how can we help get them there, right? So I'm starting to see those parallels, recently, that the way we sort of mold ourselves, I think, even as an individual, and the traits that we value, can be applied. I wouldn't say all of them, but I think many of them can be applied in at our workplace as well.
Great.
Thank you.
So I guess I just have like a quick question. So you mentioned that you were at UCLA and then like you moved to Amgen as a research scientist. I was wondering if you could talk a little bit about like, how did you initially get that job?
Yeah, it's a great question, Indy. So, my husband is a scientist too. He's a PhD, an immunologist, actually. He was the one who got a job at Amgen first. And I used to do, carpooling and commute. So where Amgen is located, it's a place called Thousand Oaks. And to go to UCLA, it takes about close sometimes on a bad traffic day could take 2 hours, close to hour and a half to 2 hours. So while Amgen is close to UCLA, it wasn't so, so close that it was very convenient. So my, postdoctoral fellowship at the UCLA happened to be in a field, and I think you may have heard me say that is where I got my exposure to monoclonal antibodies. And so, so my husband Rajendra joined Amgen first, and a position opened up at Amgen. They were looking for somebody who had molecular biology experience and had some exposure to monoclonal antibodies, because the company was just starting to think about whether or not we should get into it. And I was not so sure. When I was at UCLA, I was very driven by the work I was doing there, because I was working in Sherry Morrison's lab. It was a phenomenal lab to learn and sort of grow my sort of interest. And I was not sure if Amgen was the place for me. But we had a 2-year-old kid. Rima was very little at that time. My commute was horrendous. And when this position came up, I applied, and I happened to, get accepted. And I am so glad I did that, because my husband and he was always in the industry, and he was very driven by wanting to be in industry. I was 50% there, but I wasn't so sure. And so the circumstances, sort of pushed me, I think, in that direction. And again, having joined, I wouldn't trade what I have done now for anything. So I am so glad that I made that turn.
Yeah. Sharon?
Hi, Dr. Deshpande. Hi, Dr. Narayan. How are you doing? I'm sorry for joining in a little late. Let me go ahead and introduce myself. So I'm a second-year graduate student at Mercer University. I'm pursuing my PhD in pharmaceutical sciences, and right now would probably be like a little more clarity with where I need to go next. So there's a lot of like contradiction about how you may or may not need a postdoc to pursue a career in an industry. So I just wanted to see like what you felt about it. Has pursuing like 2 postdoctoral research, has it helped you in like, your career in the industry? So yeah, that was my question for you.
Yeah. Hi, Sharon. Nice meeting you. My experience is very positive about the postdoctoral fellowship, because that is where I feel I actually got to learn the hypothesis building, the experimental designs, and really pursuing the different paths to get to address a complex scientific issue. And also working in teams, it was during the postdoctoral fellowship, whether it was at UCLA or at University of Michigan. And I got to collaborate with a couple of folks who, were contributing to the same research project, because sometimes the scope of the project is so large that you want to have at least 2 or 3 folks working on different parts of the same problem for it to be a very successful story in the end. So that teamwork, as well as, the rigor in being able to address that scientific problem independently, were both, I think, very well executed, I would say there. And my exposure during the postdoctoral years was very positive. So I would highly recommend it if you have a chance to do that. And, there's some industrial postdocs also. So think about, you don't have to pursue a postdoctoral fellowship outside of the industry. If you get a chance to do that in an industry, then, you can start building your experience, in the same sector.
Thank you. Thank you so much. It was really nice hearing about your career journey. It's really helpful. Thank you.
You're welcome.
Anyone else?
Yeah. Hi, Dr. Deshpande. It was very nice hearing your journey, and it's always inspiring to hear, especially women in sciences, when they share their passion for science. And it's great to know and great inspiration. So, what I was wondering is when you joined Amgen or when you started working with monoclonal antibodies, it was pretty recent, as you mentioned. And now there are certain areas of science that is also very new or coming up, or something like mRNA delivery and all of that. So you said when you were joining you were a bit unsure, or it was new and challenging. So how did you tackle with that, and how did the resources help you, or what was your whole thought of thought process that went into accepting that challenges? Or I don't know if I'm putting it right, but just how did you face that challenge?
Yeah, no, it's a good question, and I will draw a parallel with cell therapy, okay, to answer your question. So when I started my job at Amgen and actually applying what I was learning in my postdoctoral fellowship, right? I was learning about how to do domain shuffling of monoclonal antibodies, how to determine which part of the monoclonal antibody sequence actually imparts function. It would have become a very academic sort of, pursuit for me in the postdoctoral fellowship, and if I had stayed at UCLA. But when I moved to Amgen, the way the company was thinking about monoclonal antibodies was more around a therapeutic. So I had to start thinking about, okay, what makes a good therapeutic? What are some of the considerations that are necessary? And it wasn't so much about the monoclonal antibody as a modality, but it was more about, okay, high expression is really needed, stability is really needed. How do you achieve, what tools do you need to put in place to then achieve that high expression? How can you make molecules more stable? So the same domain shuffling work can be done, but now with a very clear goal to improve, or clear goal to achieve stability, a clear goal to improve expression. So in some ways, in a new field, okay, and therefore, so monoclonal antibodies, as we all can now reflect, from the last few years, have become extremely successful. I would say one of the fastest growing, modalities, right, in our industry. Now, let's take the example of cell therapy, okay? So cell therapy, on the other hand, is also a new modality. It has a lot of promise, may cure, some cancers, right? However, the challenges with cell therapy, unlike monoclonal antibodies, I think are very different because it's about precision medicine. Monoclonal antibodies, we were able to use that drug to serve millions of patients, right? Thousands of people can be treated. With cell therapy, you're going to do precision medicine. You're going to take the cells out, make the autologous, format. Then you're going to put the cells back into the patient. Unless we get through a breakthrough technology to get allogeneic cell, allogeneic format for cell therapy, we won't be able to do what we're doing with monoclonals and all of our other protein therapeutics, where you make one lot and you treat thousands of patients. Okay, that's a norm, right? With the current ways of making a cell therapy product, you're not able to do that. So the reason I'm bringing this distinction up is, if you are going into a field like cell therapy, go in with the conviction, I'm going to solve for allogeneic production of cell therapy. And there's a lot of unanswered questions. The technology is going to be, prime to solve that problem. And whoever cracks that, right, is going to really have an opportunity to cure cancer. Yeah. So once we get an allogeneic product, okay, it will become an off-the-shelf therapy that will treat thousands of patients. Today, we can't do that. And it's become a, precision medicine modality only. And because of that, market penetration is not there. We can only treat few patients. And even with those patients, they have a lot of adverse events. But if we're able to knock down the genes and make an allo-specific format for cell therapy, you'll recreate a platform, just like I was able to create for monoclonal antibodies. I was able to participate in that journey. And today, monoclonal antibodies, everybody, knows how to make those, right? But we don't know how to make cell therapy. So there's a lot of our same and sort of opportunity there. The other thing, your question about mRNA, I think mRNA is going to be another modality that will also become a modality of choice for the future. There's so many different applications. I don't think we can have even imagined, how we will use mRNA as another modality, just like monoclonals, to treat diseases. The thing about mRNA that I guess for me, I'm a cell biologist, molecular biologist, that is very different. And when you're making mRNA, it's more like a synthetic process, in vitro transcription, right? It's different. It's not the same as what, one needs to do, I think, with cell therapy. So for me, while I have invested a lot of my career in the biology of cells and yield improvements, and I gravitate more towards cell therapy as a modality than I gravitate towards mRNA, personally. But that's just because I'm not a chemist. And mRNA, I think, has as a modality a very, very, I think, expansive application. And it is also a very good area. So how did I get into it? I think these are the areas where I would say go with confidence, because there's so many questions to be solved. I don't think at that time I thought too much about it, to be honest with you. I was just thrilled. I was thrilled to be part of the fact that I was in a company who wanted to invest in monoclonals. There was nobody knew how to make a monoclonal. The silliest thing I had done before making a monoclonal, I will tell you, was my project for improving half-life of FC proteins needed me to produce FcRn. FcRn requires you to produce a beta-2 microglobulin and the alpha chain. So the alpha chain and beta chain needed to be expressed in the same cell using two different plasmids. I had constructed an expression system to produce a protein like FcRn. It was as simple as that, okay? And they thought, everybody at Amgen got excited. Oh, look, Rohini has done this. So why don't we use the same system to produce the light chain and heavy chain of a monoclonal antibody? And it worked. So there's no reason it won't work for you. So it's as simple as that, okay? So I just don't think, it's probably easier said than done, but I don't think you should hold yourself back, because I think the greatness is in you, right? You have the strength, you have the qualities, the science. It's really about these problems in front of us that, you latch onto, you feel that conviction to solve and come, and there's some ideas that won't work, right? But that happens. That happens.
Yeah, passion is the moral of the story there. Thank you.
Yes.
Thank you so much.
Let's go with Sebastian and then with Smita.
Hello, Rohini. I just wanted to ask you about your experience regarding your switch from postdoc in academia and then to industry. Like, what was your biggest, like, quote unquote, culture shock or like that in terms of how the processes are thought, how they're made, everything?
Yeah, I actually, Sebastian, I apprehensive getting into industry, but my experience in the industry was very positive. So there was not as much of a pause or a shock for me. What happened was I was thrilled by the resources and the teamwork and the fact that, there was support. And once we had an idea and we wanted to pursue, there were timelines being built around it. So the application of the ideas that we would come up with was faster. In UCLA, I would have to do most of those experiments myself. I even remember going on weekends to wash pipettes. Okay, we all had to do that. And so in the industry, it was in Amgen particularly, I felt very well supported. A lot of resources. And the biggest thing there, I think, is, or I would say there's always the stress or the pressure of making an impact. But again, it's like we just talked about the cell therapy area or the mRNA area. There were so many unanswered questions and so many opportunities that I don't think I remember being in a situation at Amgen where I felt under-challenged. The biggest thing I've had to deal with in my career probably is I've always been on a stretch assignment of some sort that I didn't even know. And balancing, the act of being able to be there for my family and then also do my job really well was probably what I, was most stressed about. But otherwise, I think as a company, it was a very positive experience. As long as you're willing to work hard and, you are a team player, I think you're very well regarded. And you of course, I don't need to tell this group, I think your core competencies and those are given, right? Those are there. I mean, I think in each of you, I'm sure, there's that drive to excel. And that is recognized. That is definitely recognized and rewarded.
Smita, go ahead.
Yeah, thank you, Dr. Chirmali. Thank you so much, Rohini, for sharing your journey. It was really inspiring to know so much about your career. I just have a very generalized question. What is an advice you would give to a student, who something you would want to tell your younger self, what would you do differently, or what is something that you did that really helped you along your career path? That's my question. Thank you.
Yeah, definitely. And thank you for asking that, Smita. I told you about the human relationships being a very critical factor. I've always cherished that, valued that as a person. But I don't think I spent enough time networking, I would say, as a, younger self. And now with the tools available, to you, I would definitely advise you to network, stay connected, reach out. I think that those human relationships are going to take you, far. And you need advocates and sponsors. And so invest in that. I don't think I did enough of that.
Thanks.
Thank you so much.
Any other question from anyone? Rohini, I'm going to do a rapid fire at the end, okay? 10 questions.
Okay.
I'm Chong, and currently working as a postdoc in biostatistics and bioinformatics. And thank you so much for sharing your wonderful journey. just like have a quick question about like why when you are like dealing with like antibody developability and manufacturability, like do you rely on any like computational models?
Yes. Yes, we've built a lot of models. We have a group that I've called them data engineering group. And they invest a lot of time looking at, our sequences, alignments, and looking at their structures and making sure that we use those models to then apply when we're selecting the molecules that are coming through. And we not only use that for monoclonal antibodies, but we use those for bispecific T-cell engagers, some of the newer modalities in the multispecifics as well. So modeling is definitely a very important capability.
And Rohini, Chong has been teaching me quite a bit of things about modeling and things. We've been talking a lot about that. Thank you. So
yeah, go ahead.
No, go ahead.
I was going to say I think it's an area that can be applied to especially the bispecifics and the multispecifics that, people want to bring forward. If you have an article from great multispecifics, I would highly recommend you to take a look at that. It talks about the future of therapeutics, okay, the next era. And I am very passionate about the modeling and data engineering. So thanks for asking that question, Chong. I just wanted to share that with you because I think your skill set can be applied, again, just like those, 20 years ago, monoclonal antibodies were a problem statement. Multispecifics are a problem statement right now.
Thank you. That's great to hear.
So I'm going to pick on Amrita and Sharvari to see if they have questions. Amrita.
Thank you. You can hear me, right? Because the internet connection is going here and there. Thank you, Dr. Deshpande, for the wonderful experience that you shared with us. Lots of questions are already covered, but I just had one question that as opposed to a PhD student, where you are looking more into science, when you go and work in a company and become a leader, what you have to change personally to handle the leadership and not more into science?
Yeah, it's a good question. I think just recognizing and being self-aware that you're working with a team, is really important. I always categorized, leadership as, being that person who's willing to change, to see the, like Gandhi used to say, be the change you want to see, right? So if you want to make something happen, you cannot be in the back seat. As a leader, you have to put yourself in the front seat to make sure then that, whatever you want to achieve is actually going to be achieved. So as a leader, that's my biggest lesson is you have to take this hold of the steering wheel. You have to be in the driver's seat. Then you've got the team, around you. You've got the whole support system. But being in the backseat expecting things will change is probably not a very effective, in my opinion, leadership style. So be the change you want to see is my motto.
Thank you. Thanks a lot.
Sharvari.
Yes. Hello. Thank you, Dr. Rohini, for your amazing talk. I'm extremely inspired, just like everybody else. Like Amrita said, almost all the questions were answered, but I always had this question that since we are PhD students, like Amrita said, industry is a little different. In fact, it's a lot different. So, and people have always been mentioning about the industry academia gap. So how can you tell us, like, how can we bridge that gap between the industry and academia, and how we can prepare ourselves better for the industry apart from developing our scientific skills? What else can we do?
Yeah, I think, think about the science is probably going to be the same. Science is science, whether you do it in academia or in industry, but the way you communicate in the industry is probably an important area of focus. Like we talked about, teamwork is an important area of focus. You're also going to need to enhance your leadership in the industry. Maybe, the same applies for academia, maybe at a less intensity. So one thing I always, think about, I used to hear the term data speaks for itself. Data doesn't speak for itself. I'll tell you, being in the industry, I'll just be very point blank with you. You have to speak on behalf of the data. So if you're in the industry and you have a data graph in front of you, and that graph is not, very clear in what you are trying to communicate through that, data, then you're not doing a great job. Okay. So communication, I would say, in addition to everything we've talked about, is a very important asset. Okay. It can be a differentiator. And I don't take anything for granted. Okay. So if you have a good piece of data in your hand and your team has generated that data, you have to speak on behalf of the data and not let the data think that the data speaks for itself. So there, there are many things we can talk about, but just think about those aspects of communication, like we talk about teamwork, and making sure that you're recognizing you're there because you want to be part of the industry, because the problems you're going to solve are really going to change the world. Yeah. So the impact is going to be very, very high of what you do. And if you go in with that passion, conviction, you can do it.
Okay, great.
Thank you so much.
Yeah. So in the interest of time, Rohini, I'm just going to ask you these 10 very rapid one or two word questions, kind of one to answers to these questions. Just some for fun, some, I just want to understand. I know you, so, I'll ask you some of those inside questions. Guilty pleasure.
Guilty pleasure. Oh, gosh. Vacation.
Vacation, good. Which book are you reading?
I'm reading, actually. I'm reading my dad's book right now. My dad passed away in August, so he's written a book on our family members, Naren. So it's just we're going through some. My mom just came from India, so and I'm not good in Marathi, and he's written this. He calls and he calls it Majhe Napi. So I don't have a different, a very inspiring book to share with all of you. I'm just engrossed in reading that book right now.
That's beautiful. If you had to snap your fingers and get a skill, what would that be?
Wow. Networking.
Oh, you mentioned that before. Great. I'll ask you this question because I know you do a lot of that. And what do you think of science and spirituality? Because you've done a lot of thinking, especially with your kids and kids in the neighborhood. Yeah.
Yeah, I think both have logic to it, and I do find that. I guess I enjoy both. For me, maybe I've never mixed the two. This is a really good question that I need to reflect on a little bit more. But I do feel like, even science, it keeps me humble. There's no right or wrong, right? And spirituality feels the same way. It keeps me humble.
What do you do when you have a bad day?
I go for a walk. I'm very self-critical. I probably put myself in a situation to think about, what could I have done differently? And, when I'm having a bad day, I'm constantly reflecting if I could have done something to shift that or change that.
What would we be finding you doing on weekends?
If I didn't hear your question entirely, but
no. What do you do on weekends? Simpler.
Oh, what do I do? I love spending time with my family, cooking. I still do some spiritual bal vikas and classes like that for kids. I love watching Bollywood movies. I I do all the things that keep me connected with all the trends that are ongoing in India. I'm a big Bollywood fan, so I just like to stay connected with what's happening.
Yeah. There's two more questions, and the final question on the advice is something that people don't know about you.
Something that people don't know about me. Oh, I just learned swimming.
Oh, wow. That's a big one.
I had a water phobia for a long time and just came over that.
Oh, and which historical figure do you admire?
Historical figure, like
it
as in
it could be
monuments?
Anything. No, person.
Oh, person.
Anyone.
God.
It could be anyone. Or couple. Don't
okay.
Be one.
Jhansi Ki Rani. How about that?
Oh, okay. Okay, cool. And then, of course, the last question.
I used to do a fancy dress competition as a kid, Jhansi Ki Rani banke. So my dad used to be very proud of that. So that's why she's always been an image in my head,
And I think Ipshita mentioned, and I don't mean to undermine it, but you are a Jhansi Ki Rani. You can all see it. I'm not just picking on you. And the final question, which I think was asked by several of them before, what advice would you give them, as they are starting on their careers, and what should it be? They're all interested in industry, is sort of the common theme.
Yeah, industry is fun. Industry is very embracing. Industry is also a culture that is stimulating. Innovation is highly regarded. And so there's a need for a lot of great scientists who will come in and, solve some of the problems that are in front of us, and the rewards can be pretty, positive. So I highly encourage all of you to think about that. Don't be courageous. Don't be, apprehensive, and don't let maybe other experiences influence your own path. And, always think about the business acumen, of course, is something that is going to be very important in the industry as you step in. Financial impact is going to be an important area. If that is not for you, then of course, you make your choice. But these are, I see them as very positive, sort of traits and opportunities. So think about, the path as a positive one. I think there's a lot of need in the industry, especially for scientists. And, COVID, I think we've all sort of seen how much growth there is. We are experiencing a lot of attrition at Amgen. right now. People are changing jobs like crazy. 40 to 60% is what I was reading the other day of people have a new job just in last year and this year. So I think there's a lot of opportunity. So embrace it, be courageous.
Yeah. Thank you, Rohini. I'm going to let you go, but I'm going to let others wait for about 2 minutes just to get some feedback. But I have one comment for all of you also. Please use this opportunity to network with Rohini. She's really approachable. She's incredibly busy. I know she will take out your time. She'll take out time if you have a genuine question. Don't nag her. Just
no. I'm happy to. Please reach out, like Naren said. Thank you so much. Such a privilege to be with all of you today.
Thank you.
Have a good one.
Thank you.
Bye.
Thank you for.
A network should last a lifetime. Let us help you create lasting professional relationships with our world-class mentors through the Biopatrika Industry Mentorship Program. A strategic guidance program unlike no other, full of expert interviews, industry internship opportunities, CV writing, inflection point analysis, life maps, and of course, the gateway to your dream career. For a limited time only, all our services are freely available for you as we truly want you to succeed.